less than 60 days to ensure that all hospitals, clinics, schools and police stations have an uninterrupted electricity supply. This comes after court action by Action SA, UDM, IFP and 17 others seeking to declare the government's response to blackouts a breach of the Constitution. But what's the impact of power cuts on healthcare facilities? To discuss this, I'm joined by the head of cardiology at Chris Hani Baragwanath Hospital and a member of the Progressive Health Forum, Professor Richard. Thank you so much for your time, Professor. We do appreciate it. Let's just start off with your initial response to this court ruling saying that, for example, hospitals should be exempt from rolling blackouts.
Yes, thanks, Heidi, and good evening to your listener. I think that's a reasonable judgment. I think that's a welcome judgment. I'm not so sure why the government seeks to appeal this. I feel that it's a grandstanding and political power show because for its people who did not even need the court to recognize that schools, healthcare facilities, and indeed police stations ought not to have their power interrupted. So I'm really not sure. I suppose it's a question of what they think are priorities for them, and clearly these three being shown to be basic human rights by the courts are not a priority for our government. I'm not sure what their priorities are.
Yeah, I mean, it's really stressing to just hear that government would like to appeal this. Obviously, they're trying to find ways to avoid needing to exempt certain institutions. But, as you rightfully say, these are basic human rights. I want you to take us into your confidence, Prof, and speak to us as the head of cardiology at Chris Hani Baragwanath Hospital, one of the biggest, possibly on the African region, having to be subjected to constant rolling blackouts. How do you work in such circumstances?
It is difficult for us as a central hospital to start off with. This is the third largest hospital in the world with a lot of heavy equipment that we require for both diagnosis and treatment of our patients. A lot of this, particularly radiological equipment, they work on three-phase power supply. That means a very high voltage equipment. At Bara, at least, we are fortunate that some of our equipment have got UPS, which allows you 20 minutes to properly shut down, because there's also a danger that, without a proper shutdown, the equipment itself can easily get damaged. We really struggle to procure this equipment. I mean, we do this over a period of 2 to 3 years to procure them. So it's a very lengthy and tedious process to be intermittent power supplies. So we do, fortunately, on some of them have UPS, and we also do have generators. But obviously, generators work on diesel. So the generator will kick in, provided there's diesel. Now, if we can't even, buy food now and then for our patients, only God knows, how sustainable our pockets will be to ensure a constant supply of diesel for our hospital generator. And I'm just talking for Bara. And I'm cognizant of the fact that there are hospitals and clinics in the rural areas who will not have the privilege of, a generator and a solar power. So I think that really, it's unacceptable for government to sit there and say that we can't afford this, we can't afford that. But at the same time, they are quite happy to procure diesel to the tune of 1 billion every month And they quite comfortably can run a bloated government with so many duplicating ministries at exorbitant cost to public affairs. I mean, my feeling is that public resources in South Africa must serve the people of South Africa. So they must trim down the fat. They must cut down the cabinet posts, and they must cut down on the wastage expenditure and fruitless expenditure, and direct the money towards the basic need of the citizens of South Africa. We deserve better. You know, our government, the apartheid system abused us. Now even the new democratic government is doing exactly what the apartheid government did. That's abusing citizens, and that's totally unacceptable.
I hear you, Prof, and you know, I listen to you and I think to myself, how do you and many other doctors sit through these really difficult circumstances? I mean, we've seen footage of doctors having to perform life-threatening surgery with torches from their cell phones. It's so unacceptable. But I want to ask you this question. I mean, you've basically answered it indirectly, but because of the severity of the rolling blackouts that we are experiencing, I mean, right now we're on stage 6 load shedding. Lives are obviously at risk. I mean, you're the head of cardiology at Bara, which, you know, provides a service to some of the most vulnerable in our society. Lives are obviously at risk, and lives possibly are being lost because of the exacerbation of rolling blackouts.
Yes, most definitely. I mean, just aside from hospitals, Heidi, there are patients that are on home oxygen. There are also patients that are on nebulization devices. And, you know, there are patients that are on medications that have to be kept refrigerated, like insulins. You know, a lot of these patients are poor, indigent, really with nothing else other than their social grant, which also gets eroded by the fact that public service from government has become a rarity. I mean, even a simple thing like a post office, you know, you can hardly get. You have to go to Postnet. All this cost money. And with a small grant, social grant, really, I mean, you know, it becomes impossible. You divide that between your transport, your post office, you know, really basic stuff. In the end, it's basically all disappear into thin air. So, yeah, it is difficult, and it is dangerous for patients, you know. That depends on this thing, that patients that are on CPAP masks that need a positive airway pressure overnight when they are asleep in order to keep their airways open at home. And now you can imagine what happens if, you know, these patients cannot plug in their devices and keep them breathing overnight. I mean, you know, some of them, clearly, they do die. There's no doubt about that.
Prof, I'd like to keep you on for the whole show because I think this conversation is so important. But just lastly, I mean, you've heard parts of the beginning of the bulletin where government is possibly intending on appealing this judgment. And, you know, it might be a while until hospitals are exempted from rolling blackouts. We're on stage 6, as I've mentioned. We've been told by the electricity minister that the next 150 days are going to be really tough. How difficult is this going to be for you as head of cardiology at Bara, and just the whole hospital being able to function on a generator, and just the fact that you have to spend so much on diesel to keep the hospital going and to basically save lives?
Yeah, I anticipate that there is going to be great difficulties. I think as we go more and more into higher stages of load shedding, there are going to clearly be problems with supply and procurement of diesel. At the moment, I think we have been okay because, you know, the stages have not been that high. But I think as they become, you know, more and more higher, you know, we are going to have really serious problems with ensuring an uninterrupted diesel supply to generator to keep them running so that operations can be done in theater, so that we can operate our machines in the cath lab and in the intensive care unit. And babies can be kept warm, for example, in incubators, and so forth. So it is going to be difficult. And I don't buy the story that they don't have money, they can do this and that. I mean, they're very good at wasting money on all sorts of things that are of no benefit to our citizens. So I don't see, I mean, I can understand that it would take a bit of time, but I think I would agree with the court, the judgment, that really, I mean, they need to sort this thing out. It's not acceptable what they're trying to do.
Certainly, but we thank you so much for your time, and we thank you for the work that you do under these very difficult circumstances. That is the head of cardiology at Chris Hani Baragwanath Hospital and a member of the Progressive Health Forum.